It then took just 2 days to record the next 1,000. In Indiana, we went from one positive case of COVID-19 on March 6th to 1,786 today. And those are the ones that we know of. Our first COVID-19 death in Indiana was 2 weeks ago today, and we're at 35 Hoosiers who have now passed. Now, I will turn it over to Dr. Bach. She will give you our latest medical updates regarding not just the numbers of where we are, but also regarding the surge and what we're doing about it, not just right now, but the days leading up to today. And this would be a time, if you're keeping score at home, to get out your pen and paper. We're going to be throwing a lot of information at you. And by the way, it's appropriate that I turn it over to Dr. Box at this moment. It is, after all, the National Doctors Day. You'll hear from 4 doctors in just a second. But it probably would be appropriate to say this is the year of the caregivers, if ever there was one. After you hear from Dr. Box, you'll hear from Dr. Sullivan. You will hear from Dr. Lindsay Weaver, and then you will hear from Dr. Chris Weaver at IU Health. He'll talk about the facility, IU Health's facility, and their surge plan as we stand today. Dr. Box?
Thank you, Governor. Good afternoon. My name is Christina Box, and I'm the Indiana State Department of Health Commissioner. We have lots of information to share today, but I did want to give 3 brief updates. The first on data expansion on our website that I hope most of you have already seen, and then an update on our COVID-19 testing here in Indiana, and some information about our collaboration between our long-term care facilities and our hospitals. Hopefully you noticed that we're continuing to build out the data on our website over the weekend. We posted demographics surrounding our Hoosiers who have unfortunately lost their lives to this virus, both the age and gender of those Hoosiers. Of note is that 86% of our Hoosiers who died are over the age of 60 and 40% were over the age of 80. 66% of our Hoosiers who died were men and 34% were women. We believe that this really reflects the fact that men have higher percentages of cardiac disease, diabetes, and are oftentimes a higher rate of smoking than women here in the state of Indiana. Between Lilly and the Indiana State Department of Health labs, we are testing over 10 times as many Hoosiers today as we were able to do just a few weeks ago. We continue to have a 24-hour turnaround time from when we receive the specimen for our healthcare professionals that are on the front line, and we think that is critical for them to be able to manage these patients in the hospital. Lilly, in partnership with our ISDH lab, has provided us with greater than 3,000 testing kits, including the swabs and the viral transport media. And we've partnered with the Indiana State Police and the Indiana Department of Transportation to be able to deliver these to hospitals all over the state of Indiana that have been in need. IU Health has also ramped up their testing to just over 400 Hoosiers per day, and they will continue to expand their testing. And we are currently in conversations with another Indiana lab to hopefully be able to double our testing here, just localized in the state of Indiana. ISDH continues to prioritize our most vulnerable patients, those residing in our long-term care facilities. Our 6 strike teams have now visited over 50 unique long-term care facilities, some of them multiple times. And we've tested over 209 residents and employees. To get that help, you can go to strike team request at isdh.in.gov. We have followed up with additional visits to work with these long-term care facilities on implementation of isolation procedures and infection control. As I mentioned last week, our nurse surveyors have now visited all of our long-term care facilities and residential facilities, discussing infection control, reviewing their COVID-19 plans, and making sure that they have a contact point with our strike teams for when they are needed. Like our long-term care facility last week, our facilities, be they residential or long-term care, need time to implement their plans when they're faced with that first COVID-19 patient or that first patient that is suspected to have COVID-19. ISDH has waived several regulations with regards to long-term care facilities and residential facilities so that we can have more flexibility on space and movement of residents, with more waivers to come. Lastly, ISDH has worked with long-term care representatives and representatives of our hospital systems to develop mutually acceptable guidance for the transfer or readmission back of suspected positive COVID-19 patients or patients that we know have COVID-19. Our Indiana hospital and long-term care representatives are working on finishing that guidance now, and I can say collaborating in a very amazing manner. This is critical not only for the protection of our long-term care residents, but also to ensure that our hospital systems have the capacity when it's needed to care for that wave of COVID-19 patients that we're expecting. It's now my pleasure to introduce Dr. Jennifer Sullivan, who is the Secretary of Family and Social Services Administration.
Good afternoon. My name is Dr. Jennifer Sullivan, Secretary of the Indiana Family and Social Services Administration. Our agency is vital to support Indiana's COVID-19 response for social services and the protection of vulnerable individuals and families. We are incredibly lucky to have a large group of physicians working in this administration with both clinical and public health training to help respond, even outside of our usual duties in state government. I would like to take a few moments to describe how the upcoming surge in critical care for COVID is being planned in Indiana. As a practicing pediatric emergency medicine physician, I am grateful for the opportunity to be part of this response, both at the patient bedside on the front lines and also to protect Hoosiers in the coming days and weeks. First of all, the state of Indiana didn't just start this. Each hospital has a disaster plan in place, and the state started to work alongside healthcare leadership weeks ago on plans related to the novel coronavirus. Planning became more specific for state health and hospital officials as models of the impact of coronavirus became available. Researchers in Indiana and within our own staff have developed models, and there are others across the country that have done the same. Based on those, we believe that Indiana's COVID patient surge will begin soon, and peak surge is expected to be mid-April to mid-May. Every hospital and hospital system in Indiana has been working on a surge plan, and we have been discussing those plans as a cross-sector group. In order to coordinate, share best practices, and manage resources collectively, we are helping to streamline those plans and facilitate communication at unprecedented levels. Healthcare preparedness in Indiana is generally grouped by 10 regions. Each region has begun to consider how it can work together to serve its citizens. Our goal now is for the hospitals in each region to plan together as one system for surge management. Over the next week, state health staff will intensify the work we are doing and with each region to put into action the plans that have already emerged in the Indianapolis metro area. Here in Indianapolis, as we announced last week, a regional operations center has opened that includes representatives from the 5 major healthcare systems that are now working together as one: Ascension, IU Health, Franciscan, Community, and Eskenazi. Here's how the surge plan process works. Each hospital has a baseline number of total beds. This includes the number in each facility that are ordinarily designated as critical care beds. Some refer to these as ICU beds. Each hospital also has a baseline number of ventilators, which we know some COVID patients will need. In Indiana, the baseline for critical care beds was 1,432. As of today, in EM resources, we have 1,940, which is a 35% increase with the first phase of surge planning. While this number may be useful, hospitals can increase the number of critical care spaces they have at a moment's notice, which is how surge planning comes into focus. For example, in the ER, we routinely use non-traditional space to manage increased and concentrated patient flow. The number of beds in our ED is pretty irrelevant. It is the supplies and people that we need to take care of critical patients. This type of surge requires that as well, but instead of managing for hours or days, it is weeks or months. For example, as of March 1st, our baseline recording of ventilators was 1,177. Based on the surge models we have, our goal is to double critical care capacity and the number of ventilators to respond to surge. Indiana already has hospitals that can turn every bed they have into critical care beds, and we have identified those sites as possible surge hospitals for each region. Here's how the number doubles. Each hospital is increasing its critical care capacity by opening up existing bed space and turning other spaces and facilities into critical care beds. This is being done by ending elective surgeries, turning lower acuity beds into critical care beds, using operating suites in the hospital for critical care beds, turning recovery room suites into critical care beds, ending outpatient surgeries that are not connected to hospitals and using those facilities for beds. With these and other mechanisms, hospitals will double their space for COVID patients. And this is the same type of planning that is used for a mass casualty incident on a much smaller scale. I'd like to now introduce Dr. Chris Weaver, who is the Senior Vice President of Clinical Effectiveness at IU Health and an emergency physician. We've asked him to give some specific examples of how surge planning is happening right now in their facilities.
Thank you, Dr. Sullivan. I'd like to first start by thanking Dr. Sullivan, Dr. Box, the governor, and the entire state leadership team. I would say that the leadership and partnership that's been established is nothing short of exceptional. I would like to also add to that all the other health systems and hospitals across the state of Indiana have really partnered together well, and that's been really pleasant to see and has really helped us prepare for this. Now to speak to within IU Health itself, I'm really proud to be here and represent what we're doing and the hard work that the team members are leading behind. As Dr. Sullivan described, we are working hard to focus and cohort patients with COVID-19 within our spaces to help us with personnel, with PPE, personal protective equipment, and other things that allow us to provide the best care possible to all Hoosiers. We're also working hard to work on getting patients outside of the hospital and create capacity. Dr. Sullivan listed the move to stop elective surgeries. We're also teeing up home health initiatives to help provide that care at home instead of in the hospital, and we've created a great deal of capacity behind that. And then specifically to our surge planning, we are focused on 3 broad categories, and that would be space, personnel, and equipment. Space is an obvious one, as the state is leading behind, and as Dr. Sullivan just described, we are working hard to double our intensive care space, or ICU space, across our system. We're focusing that within each of our facilities, expanding to each of the regions in our health system, and then across the entire state, and then partnering with others outside of our health system. Some specific examples would be in the metropolitan area. We have worked hard with the Riley leadership team. They have moved neonatal patients and infants and kids that are in Methodist Hospital and other suburban hospitals to Riley by increasing their capacity. From there, that allows us to take the neonatal intensive care and other pediatric spaces and turn those into adult intensive care spaces and really expand our capacity for those patients. In addition to that, Dr. Sullivan mentioned some of the use of recovery space and other places across the hospital, and then reaching outside the classic hospital walls to partner with our surgery centers and other places like that where we're able to take care of such patients and set up that capacity. Moving from the space piece of it, I mentioned people and our personnel. That's a major constraint and a big challenge for us to meet this wave that's coming our way. Really proud to say that we've been able across our system to establish a resource pool that is pulling individuals from, mentioned earlier, the stopping of elective surgeries and outpatient non-urgent visits. We've been able to pull individuals, whether it be physicians or nurses or other team members, into a statewide resource pool within our system that each of our hospitals can reach out to and pull experts to help expand their team as our patients increase and to be prepared for any of our caregivers to get sick and be taken out of commission. In addition to that, we are taking those individuals who have not worked in the critical care over the last couple of years that are greatly prepared and excellent providers and doing some on the site, at time training to get them up to speed. And then we're really changing our care models. We are taking an approach of a tiered care model and team approach so that we have our critical care providers that have been doing this every day for the last 5, 10, 20 years, partnered with those that have been in other specialties and doing other things in a tiered manner so that they have that oversight and expertise and are allowed us to reach more and more patients as we reach this surge. And then lastly, but definitely not least in this discussion, is equipment and supplies. You've heard plenty about that from this team and the challenges with personal protective equipment and all of our supplies across the state. I'll speak to ventilators specifically. We have worked hard to set up a pool for that, just like I mentioned about our personnel, where we know every ventilator across our system and its capabilities, and to allow each facility, as they appear to run close to their edge of what they have available within their hospital, can reach out to that, and we can transfer and get the right amount of ventilators to their site at any time. In addition to that, we're working to take anesthesia machines, as we mentioned, stopping elective surgeries. That allows us to have some anesthesia machines that we can repurpose, use as ventilators, and they have that capability, and to get those into play and greatly allow us to expand our ventilator capacity. In addition to that, we have a great team that is working hard to reach out across the country and partner with vendors and others in all aspects of our supply distribution to maximize the personal protective equipment, ventilators, and all such equipment that we could need. I will turn it back to Dr. Sullivan.
Thank you, Dr. Weaver. Additionally, the surge plan calls for moving less critical patients to alternate facilities. Those could be neighborhood hospitals that would be used for inpatient care, medical clinics that could be used for inpatient care, state-owned hospitals such as the unopened floors at the Neurodiagnostic Institute Hospital in Indianapolis and the Richmond State Hospital. As needed, our State Health Commissioner, Dr. Box, will direct that recently closed facilities, such as a hospital in Michigan City, a hospital in St. Joseph County, be opened. And the state will use new rehabilitation facilities in places such as Clark County and St. Joe County to serve as step-down beds for non-critically ill patients. I couldn't be more proud of the spirit of collaboration and coordination that is happening in Indiana preparing for our surge. My sincere desire is that much of this will go unused as all of you continue Governor Holcomb's directive to hunker down Hoosiers. However, there is absolutely a possibility that the best surge plans and social distancing measures will still require us to find alternative resources to care for large numbers of patients, and we are planning those levels of surge as well. I'd like now to introduce Dr. Lindsay Weaver, ISDH's Chief Medical Officer, an emergency physician also trained in clinical ethics and palliative care, to discuss supplies and people needed to support surge planning.
Good afternoon. I'm going to spend the next few moments to talk about the resources and people that are needed to facilitate the Indiana surge response. ISDH has been charged to catalog and support these resource allocations across the state. Personal protective equipment will continue to be in high demand, which is why we're searching for every piece we can possibly find. We won't be able to get everything we want, but we are working to get everything we need. We have received PPE through 2 deliveries from the Strategic National Stockpile, purchasing from Indiana-based vendors, donations from both individual and corporate Hoosiers, as well as the work of the Department of Corrections. These numbers only represent what we have received at the state and not what hospitals already had at their facilities. Additionally, we have just received our 3rd and final shipment from the Strategic National Stockpile. While supplies to date have been limited, we have distributed them to 285 hospitals, local health departments, long-term care facilities, and EMS providers that have expressed a need. If you are able to assist in supporting our efforts to supply our front line with this vital equipment, please email covidresponse@iedc.in.gov. While the vast majority of people who get COVID-19 disease experience only mild symptoms, some will need hospital care, and a portion of those will need a ventilator. As of March 1st, we identified a baseline number of 1,177 ventilators in Indiana. Hospitals have worked to increase that number by reallocating ventilators through additional resources such as operating rooms, ambulatory surgery centers, EMS and National Guard. And similar to bed capacity, our surge planning has focused on the goal of doubling the number of available ventilators in Indiana. While our immediate efforts have focused on building bed capacity and ventilators, additional surge planning has focused on designating alternate care facilities should our current efforts be exhausted. The Indiana National Guard and the Department of Homeland Security, in conjunction with FEMA, are developing facilities that could be stood up in 72 to a 96-hour time frame. We will also need more clinicians. We need them to provide care during the surge and also to provide relief to our frontline workers. That's why, right now, we are asking retired physicians, those clinicians who have not been working because elective surgeries have been postponed, anesthesiologists, and medical trainees to step forward. Over the weekend, through the Professional Licensing Agency and medical associations, we released a survey asking healthcare professionals to volunteer to be a part of Indiana's response to these efforts. As of this morning, we have received over 5,300 clinicians who have volunteered, stepped up, and stepped forward to provide what we expect will be much needed relief. A link to this volunteer survey is also available on our website, coronavirus.in.gov. Additionally, we are partnering with the IU School of Medicine and School of Nursing on how we can best utilize their soon-to-be graduates and students. The governor has requested General Lyles to call up the National Guard Medical Force package to support staffing as well. We said that every hospital has a disaster plan in place. Those plans include decision-making for individuals and for family members. It is just as important now, as it always is, to talk to your family and your loved ones about what your wishes would be if you were to fall ill and not be able to speak for yourself. It is time to have that conversation now. As an emergency medicine physician, I have the honor of caring for patients on the front line. I want to personally thank all of you who are doing what you can to stay home, social distance, and slow the spread.
Thank you, doctors, for those impressive reports. Ladies and gentlemen, there will be a beginning and a middle and an end to this pandemic. And right now, as our numbers are growing, I think it's only appropriate to underscore the fact that as we see the surge coming, we see a true surge of Hoosier kindness and love and generosity. Matter of fact, right now, I don't know if the Hoosier spirit's ever been stronger, to use Dr. Sullivan's word about our state spirit. But let me just take a moment very quickly before we answer any questions that you might have around the state of Indiana. I did want to specifically point out our appreciation for all of the essential workers who are packing and loading and unloading, and all the truck drivers that are making sure supplies is getting to the shelf. And that we not only understand, but we are profusely appreciative of those long hours, back to back to back to back. We have noted on occasion just how hard everyone is working, our doctors, our nurses, our assistants. But for you that are on the road day after day after day, making sure folks have the confidence and the comfort knowing they can get those essential items, this is immensely appreciated. I also hope it wasn't lost on anyone what Dr. Lindsay Weaver just mentioned when she said over 5,300 Hoosiers stepped up to volunteer in what I would consider our greatest hour of need. This is reflective of who we are. And if you're contemplating pitching in, there's room in the inn. We need more people to step up and help. The more that do, the faster we'll all collectively get through this. And this is a way to stay connected with one another in the areas most needed. I also just wanted to point out a couple, there's too many to list today. We'll be back Tuesday, Wednesday, Thursday, Friday with more updates. But I did want to just point out all the creative ways Hoosiers are staying connected to one another, whether it's teachers staying connected to their students, whether it's neighbors up in Fort Wayne with the Way Fort Wayne 7 p.m. step out on your front porch and give your neighbor a shout or a wave, just checking in, making sure folks are doing okay that are close to you. This is all so important that we keep connected to one another. And then lastly, I wanted to say thank you to all those hotels that we're hearing from. You talk about folks stepping up to volunteer. We've got hotels all over the state of Indiana who have said to us, nothing is off limits during this time. That is so appreciated. Whether it's cooking 2,000 meals in a kitchen that used to be hustling and bustling, or whether it's housing our Indiana National Guard members or state troopers, you have said to us, nothing is off limits, and we just wanted to say thank you. You've got our backs and we've got yours. With that, we have access to our COVID-19 task force here. They're properly socially distanced, but we're here to answer any question that you might have around the state. Today there's a little twist on our format in that we've gone statewide to make sure that we can answer questions in every quadrant of our state.
First, we have Emily Hopkins of the Indianapolis Star.
Hi, Governor Holcomb. My question is about some reports earlier today that Senator Mike Braun said that we had 3,700 hospital beds with ventilators as of about 2 weeks ago. And I was just wondering, by my math today, you said the state has 1,927 ventilators. I'm just wondering what the 3,700 number comes from, and sort of if there's any kind of clarity you can bring to that number.
Sure, and first, let me just pile on the praise to Senator Braun as well for helping in record speed past phase 3, the stimulus that is coming our way to help us weather this storm. That took an enormous amount of perseverance and determination on behalf of House and Senate members. But they did exactly what states were asking be done. And so thank you to Senator Braun and his colleagues in our congressional delegation. We will get with Senator Braun ASAP to make sure that he is looking at our statewide numbers. Our numbers are current and absolute.
Up next, we have John Russell of the IBJ.
John?
Hi, Governor. Thanks for taking my question. Beyond the steps that you and your doctors have outlined about trying to expand capacity, staffing, equipment, and so forth, are there any plans like some other cities are doing in Baltimore, Chicago, New York, to set up temporary field hospitals to handle hundreds, maybe thousands of patients outside the traditional hospital settings?
Yes, John. I'll turn it over to Dr. Jennifer Sullivan, to talk about how we will expand if needed.
Thank you so much for the question, John. That is absolutely part of the global plan that we have to think about for different modeling around surge. When you start with a plan A, you always have a plan B and generally plan C and beyond. We absolutely are in conversations with our partners at FEMA and here with the National Guard that field hospitals and alternative care sites can be stood up with as little as 72 hours notice. And that is part of surge planning that's happening with hospital networks by regions that are working together so that we know exactly when those trigger points are and we stand up the right resources at the right place at the right time. Thank you.
Eric Berman, WIBC.
Eric?
Eric, you have to unmute your personal microphone.
Love technology, but yeah, this
I'm
is
not telepathic.
We'll work on that on the next one. Two related questions for Dr. Box, actually. Dr. Sullivan a few moments ago said we expect the surge to come from mid-April to mid-May. I believe you had said last week mid to late April. Are we saying that we expect that to be a longer, more prolonged surge, or are we saying that it's going to fall into that range? And then secondly, in terms of personnel, 5,300 people coming forward, how much do we need in terms of personnel, and how do we go about cross-training folks who are in different specialties who don't normally work in critical care?
Really good questions, Eric. First of all, with regards to when the surge is going to be, it depends on what model you look at, and each model is only as good as those different variables that are fed into it. We feel like the surge will probably be mid-April to late April, but it could be as late as mid-May, and we don't know. Again, that surge could be more of a flattened type surge, and that would be over a longer period of time. It could be more peak, but we're really feeling that it's going to be more flattened. And then with regards to the personnel, you know, I think what hospital systems are really trying to do is to train and familiarize their current nurses that have been ICU nurses, ER nurses, OR nurses, and those individuals that can work on the higher level jobs like in the ICUs with the more critically ill patients. And then we can backfill with individuals that are volunteering. And we have to consider who those volunteers are. If they're elderly physicians that have retired, or people that are immune suppressed or pregnant, then we want to make sure they're doing more of a telemedicine job. So it will really depend on what the different regions of our state need at any particular time as to what those individuals will do.
Nikki Kelly with the Fort Wayne Journal-Gazette.
Hello, Nikki.
Nikki, you need to unmute your own computer as well. Nikki, we'll come back to you. Abdul Hakim Shabazz, Indy Politics.
Abdul?
Good afternoon, Governor. Question for either you or Dr. Box or Dr. Sullivan. The University of Washington's Institute for Health and Metrics Evaluation has been looking at all 50 states, how they're handling COVID-19, patients, beds, et cetera. They were predicting a peak a couple days ago around the 14th. Now that's moved to the 17th. Also last week, they said Indiana would probably have a 2,400 bed shortage. Now it looks like a 5,000 surplus. And the number of deaths to COVID-19 by late April would be about 940 versus 240 they projected last week. I know a lot of folks kind of look at the same data. Are you folks seeing this same data in your algorithms? And if so, our efforts to social distance with the state of Indiana, would you say right now it's working?
I would, but Dr. Sullivan?
Thanks so much for the question. There are multiple different types of models, and as you can imagine, in something this new, there's going to be a wide range of the worst case scenario and best case scenario, and we plan for both. The Washington model, just like any other model, is subject to changes in data. This weekend, the number of deaths due to coronavirus in Indiana was low, and so the changes for how that manipulates the math of how those projections work can change from day to day. And so relying on one data point just for this last 24 hours is not sufficient for us to change or really be able to start celebrating yet. We hope that we can see that maintained over time, but we will continue to plan for that not being the case. Thank you.
Thank you, Doctor.
Up next is Joy from PBS Michiana.
Joy?
Hello, Governor. Thank you so much for taking my question. So the guidelines that were issued by the president yesterday are suggesting that social distancing should be kept until April 30. Would that mean that the stay-at-home order for the state of Indiana will potentially be extended up to the same time?
It doesn't mean it will, but it very well could. I mean, we'll adjust to the facts on the ground in the state of Indiana on a day in, day out basis, weekly basis, And I appreciate the president looking at the global picture around the country and the guidance that they continue to put out. We absolutely factor their guidance into the decisions that we make. We are in touch with them every day on almost an hourly basis. But our numbers will determine our executive orders here in the state of Indiana. Thank you.
Thank you so much.
We'll now return to Nikki Kelly of the Fort Wayne Journal-Gazette.
Hi, Nikki.
Hi, Governor. I wanted to say thank you, first of all, for the ICU bed and ventilator numbers.
Yeah.
I was wondering if you could tell us what percentage of those are currently in use. And also, what are the plans for the 36 Indiana counties that have no hospitals?
Dr. Box.
So good question, Nikki. At this point, we have about 40% of our intensive care beds open in the state of Indiana. That doesn't necessarily equate to the ventilators because not every individual that is in an intensive care bed will need a ventilator, and I don't have that number right off the top of my head. What was the second part of your question? Oh, I'm sorry, the other counties that don't have a hospital. Well, that is where Dr. Michael Kaufman with the Department of Homeland Security is here and working very, very hard on planning and how we will be able to transport individuals. And I might ask him to come and answer that question.
Thank you, Dr. Box. Our EMS system across the state is very robust. We have over 24,000 EMS professionals operating in the pre-hospital environment, operating almost 2,000 ambulances across the state of Indiana. During normal operations, these providers respond to almost 1 million calls per year across our state. We've mobilized this force from both our municipal 911 providers as well as our private EMS industry. Any surge plan is going to be contingent upon moving patients both in and out of the healthcare system. And while it will take time for that equilibration to occur in the facilities, our EMS system will be there to continue to deliver the patients with the greatest amount of need, as well as be able to move patients away from those healthcare facilities as their condition improves and take them either to their homes, extended care facilities, or alternate hospital destinations where they can continue to receive convalescent care. So our EMS system is ready, and we're working on additional plans should additional transportation be necessary, and working with the National Guard and the force packages that they can also bring to the table to ensure that patients continue to move across the state in and out of the healthcare system as needed. And that includes those 36 counties where the hospital facility resources might be lacking.
Up next, we have Steve from KPC Media.
Hi, Steve.
Good afternoon, Governor Holcomb. Thanks for taking my question.
Absolutely.
One thing that I wanted to know, I talked with our healthcare provider with Parkview Health just this past week, and they said that testing supplies remain in limited quantities and is not currently meeting the need. I know with Indiana posting about 300 new cases per day, I was just wondering if you guys could answer questions about the availability of testing supplies and whether what we're seeing now is an accurate representation of the number of cases that we're seeing, or if it's more due to a limiting factor of we're just not testing enough to truly identify where the virus is and how fast it's transmitting.
It's a good question. I know that Allen County has relied a lot on their own testing and worked through some issues with that, but we have the ability through Lilly here in the Indiana State Department of Health to test more, especially those patients that are admitted to the hospital, those patients that it's critical for the healthcare providers to know those results quickly. So we would really like to see more of those transported here to Indianapolis, and like I said, we have a 24-hour turnaround time with that. We are working to continue to increase that number as IU ramps up, as Lilly continues to increase, and as we work with other labs here in the state that could potentially in the near future double our numbers that we're testing. If you're referring specifically to the ability to have viral swabs and transport media, Lilly has also been partnering with us on that. And we, as I've mentioned, been able to get viral transport media and swabs out to hospital systems all over the state. So I did have a discussion with your incident command manager at Parkview Hospital up there, and would be happy to circle back around with them to make sure that they understand the access that they have to get that testing done right here in the state and more quickly.
Up next is Richard Essex, Wish TV.
Hi, Richard.
Wish TV, you need to unmute your own microphone. Wish TV will come back to you. Cameron Riddle of RTV6 Indianapolis.
Hi, Cameron.
Hello, Governor. Good afternoon. The ACLU just this afternoon has requested that folks who are incarcerated, who are at high risk, but maybe not a violent threat to society, be waived, including their bails, and folks, again, who do not, who may not have been already completely processed, but to free up space inside of the Indiana Department of Corrections. And then second question, if I may, Indianapolis is now a hot spot according to the U.S. Surgeon General. What are we doing in this city to slow that hot spot from continuing to grow?
I'm going to take the first one and then circle.
Sure. The Department of Correction has received the requests from the ACLU. We also are very concerned about those who we were serving and are taking all precautions that we can to keep them safe. Our team will continue to look at what we're doing and respond as appropriate.
And I think I want to add to that our strike teams that we're using for our long-term care facilities and our residential facilities, we're also going to jails and Department of Corrections as needed. We're called out there. We do the same type of investigation and surveillance there, and infection control procedures and isolation, and individuals that would become ill there would be transported to the hospital for the same reasons anybody else would be transported. Oh, Marion County, I'm sorry. So, yeah, if you want to look at the number of cases we have, certainly Marion County has a significant number of cases. Again, that's not unusual. That is our largest metropolitan area here in the state of Indiana. So in Indiana, just like every other state, there will be a larger city that will have more cases. But we really believe that we're going to be able to flatten that curve and decrease that burden on the healthcare system with the measures that we've taken with social distancing.
And I'll just add that I was in communication with Surgeon General Jerome Adams this morning, and it just goes to prove that you don't have to live here to look at the numbers and track the numbers. And I appreciate their whole federal team with eyes on every single state. And it just underscores what Dr. Box just mentioned, that we need everyone to be playing by the rules so we can play through this. Next question.
Up next is Kayla Sullivan of Nexstar.
Yep. Kayla?
Hi, Governor.
Hi.
I would like to ask, how can the state better enforce required workplace precautions for COVID-19? We're still getting reports from workers that they're working in dangerous conditions. They've reported it to IOSHA as suggested by the state, but they're worried that this may not be the quickest way to address their concerns, as this is such a fast-spreading disease. Are you looking into alternatives when it comes to enforcing these workplace guidelines?
Well, of course, the on-the-ground enforcement will continue to rest with the local law enforcement. I will just tell you this, that we are paying attention to every single complaint that comes into the state for review. I will also tell you, as we monitor potential infractions, we have noticed that over the last few days, last week, they are starting to decline at an exceptional rate. We're pleased about that. Maybe news traveled slow to some places, but it is effective in every place. And so we'll continue to work with our local health departments, with our local prosecutors, and law enforcement to make sure that people are not just taking this seriously, but following the rules. And of course, I don't want to deter anyone from contacting the state. Know that we are working with your local officials to make sure, again, everyone is playing by the rules.
Up next is Brandon Smith from IPBS.
Hey, Brandon.
Hey, Governor. This is probably a question for Dr. Sullivan, but as we talk about now, folks who are retired physicians and nurses or med students being able to practice, what sort of practice are we talking about? How are we going to ensure that people are getting the care they need while observing the sort of safety guidelines that licensing usually provides?
Yep, great question. We actually have four doctors that could answer that, but.
So I just had meetings earlier today with Dean Hess's team and with our Dean of School of Nursing, and we have been discussing at length the ability to have fourth-year medical students that are just recently graduated and nursing students and advanced practice nurses and other individuals that are just completing their degrees be able to work under the direction of other physicians and other nurse practitioners to be able to deliver care. Basically, they are only lacking their residency and would need to have support from other physicians for guidance. There are a lot of medical students that are interested in volunteering, and we're working to find out what parts of the state they're interested in volunteering in and what hospital systems we can connect them with. And they could do all kinds of different jobs, from backfilling in long-term care facilities or rehab facilities, working in the hospital with the less acute patients, or potentially even working under an intensivist in an ICU setting to help manage patients.
Rich Nye, WTHR.
Hey, Rich.
Hello, Governor. Do we have any access in Indiana to rapid COVID tests that can provide results within minutes instead of 24 hours?
We have, Dr. Box, you want to take that?
There is one reported group that's doing some rapid COVID testing that we're looking into here in Marion County. I know Marion County Health Department is working with them, but there are no rapid testing abilities here other than the 24-hour turnaround that we have.
Whitney Downard, CNHI.
Hey, Whitney.
Hi, thank you so much, Governor Holcomb. My question is whether or not we're going to revisit what we define as an essential business. For example, I've listened to some dentists and dental associates who've said they're kind of mixed about what they can do, and I can imagine that those licenses that they have could actually help with that voluntary workforce that we've discussed earlier. So is there any thought to revisiting that when it comes to specific industries who might not be clear where they fall?
Spot on. We addressed that in today's executive order, and you're exactly right, including dentists. We hope that as some are no longer open during this stretch, that they will volunteer their time in some other needed areas. So yes, they are addressed in this executive order that I just signed today. As I mentioned at the outset, this executive order in large part not only expands, to your point, but also clarifies.
Tom Davies, The Associated Press.
Hey, Tom.
Hello, Governor. My question is, do we know yet, have numbers yet on number of patients who are hospitalized or recovered? And also, is there a worry about community surge having started anywhere outside of the Indianapolis area?
Well, we're looking statewide. It's all relative, as I mentioned, I think Friday, whether you're an urban, suburban, or rural health facility, and the strains that this could potentially, probably will, put on your facility. So yes, we're looking at all 92 counties, whether you're Marion or Hamilton or Johnson or Ripley, Franklin, or Switzerland. You want to talk a little bit about the first part of his question about known recovered patients and how hard that is to pin down?
I'm sorry, April 2nd and 1st is almost here, and we'll have those ICD-10 codes, which again, I know mean nothing to you, but it's a way for us to be able to collect more data about individuals that have been very ill in the hospital and what happened with them and how they did, what their comorbidities are. So we are trying to add data every single day and as frequently as we can, and that's just a question of being able to collect that in a better fashion. Also, I want to say that there are other areas of the state besides Marion County that are experiencing per capita increased numbers of cases, especially in our central south eastern part of the state. And we have been over and working over there. In fact, Dr. Weaver was over there on Friday night, meeting with the head of one of their hospital systems over there.
Our last question comes from Jeff Smith at WLFI in Lafayette, Indiana.
Yeah. Hello.
Governor, how you doing? Thanks for doing this.
Thank you.
Hey, I wanted to follow up on a question that Kayla had for you. And I'm talking more in terms of Hoosiers versus businesses. Are you satisfied with the amount of social distancing that people, or do you think they're taking it seriously enough? And on the business aspect, do you feel that some type of enforcement may be needed for what truly appear to be non-essential businesses?
Well, we're not batting 1,000. I think for the most part, Hoosiers are taking this seriously. I think with every day that goes by, whether you start to learn of someone close to you that's been affected or infected, or when you learn of someone close to yourself, or as you're watching television or listening to the radio or reading in the paper, just the spread that is occurring, the hot spots that are popping up all over the country, people are taking it more seriously. But we'll continue to work with our local partners. This is a local, state, and federal healthcare crisis that's upon us, and we'll continue to work together to make sure that we're enforcing the laws. I'm pleading on a daily basis that this is not a game. This is serious. You may feel like you're Superman, but I guarantee you, you're not. You may never experience any of the sickness. You may never become infected yourself. For the most part, if you do, you're going to get through this just fine. But just think about the folks that you may adversely impact unknowingly by being careless. This is a time to hunker down, Hoosiers, and play by the rules. That's what we do. And as a team, together, we're going to remain Indiana strong. Thank you all very much.
Once again, we'd like to thank you for joining us. The governor will hold his next briefing tomorrow at 2:30 p.m. Eastern Time.